Morning students, yesterday we have started with new topic, that is parenteral products. So yesterday we have seen definition of parenteral products, what are the advantages, what are the disadvantages, what are the different requirements for preparation or formulation of parenteral product. Now we have to see what are the different vehicles and additives used for the formulation of parenteral products. So first of all, vehicles which are used for the formulation of parenteral product. So the vehicles which are used for the formulation of parenteral product may be of two types. One is aqueous and another one is non-aqueous, that is oily vehicles. So aqueous, non-aqueous vehicles are decided depending upon the requirement of parenteral products. So the basic function of vehicles is vehicles are used for carrying active medicament along with different additives. So active medicament and additives are carried by vehicle to the desired site. As well as during the formulation process, vehicles are used to dissolve your active ingredient and excipients. Ingredients are dissolved in a vehicle which can be aqueous or non-aqueous. Water is used as a vehicle for majority of injections because water is tolerated well by the body and is safest to administer. So water is a majority of vehicle, as you knew that majority of liquid formulations are prepared in the water as a vehicle. Why? So water is a universal solvent. Majority of drugs dissolve in water. Plus, one of the major advantage of water is that it is well tolerated by body. It is non-toxic and it is safe to administer. So there are different types of water which are used for the preparation of parenteral products. So first one is water for injection. So most frequently used for parenteral formulation. Distillation method or reverse osmosis may be used for preparation of water for injection. So distillation, as you might have already studied, reverse osmosis you might have studied. So these are the methods which are used for the preparation of water for injection. So the distillation or reverse osmosis is carried out to separate various liquid gases and solid contamination and undissociated substances such as pyrogens present in the water. So pyrogens, undissociated substances, various contaminants, other unwanted particles can be separated with the help of distillation or by use of reverse osmosis. It is clear, colorless, odorless, and having pH of 5.7. So water for injection is clear for observation, colorless, no color, no odor, and the pH range is 5 to 7. So what is the pH of water for injection? It is 5 to 7. It contains total dissolved solids not more than 1 mg in 100 ml and no added substances. So what is the requirement for water for injection? So total dissolved solids in 100 ml of water for injection should not be more than 1 milligram. So if total dissolved solids are more than 1 milligram, then that water cannot be used as a water for injection. So what is the basic requirement for water for injection? That 100 ml water for injection should not contain more than 1 milligram of dissolved substances and no added substances. It may not sterile and pyrogen free. So water for injection may not be sterile and pyrogen free. It is collected in sterile and pyrogen free container. It must be stored in tight container at suitable temperature and used within 24 hours. Once the water for injection is prepared, it should be used within 24 hours. Next is sterile water for injection. So sterile water for injection is pyrogen free and endotoxin level should not be more than 0.25 USP units per ml. So it should be pyrogen free. Likewise, we have seen that water for injection is not pyrogen free, but sterile water for injection is a pyrogen free as well as it is sterile in nature as name indicates, and endotoxin level should not be more than 0.25. So what mean by endotoxin? So endotoxin are the metabolic product of bacteria. So endotoxins should not be more than 0.25 units per ml. It may not have any added antimicrobial agent like substances Antimicrobial agents may be added or may not be added in sterile water for injection. It is packed in single dose containers not larger than 1 liter. Single dose containers means once you open this container, you have to use all the water, sterile water for injection. Okay, you cannot again recap that water for sterile water for injection and again use. Once you use the container, you have to, once you open the container, you have to use that water for injection at a one only. This water may be used as a solvent, vehicle, or diluent for already sterilized injectable medicaments. So sterile water for injection may be used as a solvent, vehicle, or diluent. It is mainly used for reconstitution of multiple antibiotics. Reconstitution. Now the word is reconstitution. Now what mean by reconstitution? So the word reconstitution here denotes that the antibiotics are present in a solid powder form, and at the time of injection, sterile water for injection is added in that sterile powder. Okay, so sterile powder is present, and at the time of injection into the patient, sterile water for injection is added, and that process is called as a reconstitution. Because of the leaching of the solids from the glass lined tanks during sterilization, there is increase in solid content of sterile water for injection than water for injection. During sterilization, what may happen? Solid content may increase. As we have already seen, the water for injection solid content should not be more than 1 milligram in 100 ml. Then next is the bacteriostatic water for injection. So first one was water for injection. These are the vehicles and these are the aqueous vehicles. So water for injection, sterile water for injection, bacteriostatic water for injection. So bacteriostatic water for injection, it is a sterile water for injection containing one or more suitable antimicrobial agents. One or more suitable antimicrobial agents. So water for injection containing antimicrobial agents is called as a bacteriostatic water for injection. Pre-filled syringes or vials containing not more than 30 ml of the water are used for packaging of this type of water. Pre-filled syringes or vials. Now what mean by pre-filled syringes? So syringes, syringes which are used for injecting parenteral product inside the body. So physician or doctor takes out the parenteral product inside the syringe from the vial or ampoule and then inject in the body. But these syringes are already filled. फिजिशियनला या सिरिंजेसमध्ये ड्रग घेण्याची गरज पडत नाही, तर या सिरिंज ऑलरेडी फिल्ड करून आलेल्या असतात, त्या फक्त ओपन करायचे आणि इंजेक्ट करायचे, बरोबर. सो प्री फिल्ड syringes or vials containing not more than 30 ml of water are used for packaging of this type of water. In the preparation of the small volumes of the injectable preparation, bacteriostatic water for injection is used as a vehicle. SVP, small volume parenterals. So in case of preparation of small volume parenterals, bacteriostatic water for injection is used. It may provide flexibility for packaging of multiple dose vials because of presence of bacteriostatic agent. Now look at this sentence. So multiple dose vials can be prepared for bacteriostatic water for injection because it contains bacteriostatic agent, antimicrobial agent. Like sterile water for injection, you have to, once you open the container, you have to use that water. But in case of bacteriostatic water for injection, you can use once, twice or thrice because it contains bacteriostatic agent. This water is specifically labeled as per the USP requirements as not for use in neonates. So bacteriostatic water for injection is not suitable for use in neonates. Neonates means newborn babies. So newborn babies, in case of newborn babies, and bacteriostatic water for injection cannot be used. Next, look, now three types of waters are generally used: water for injection, sterile water for injection, and bacteriostatic water for injection. Next is non-aqueous vehicles. Non-aqueous vehicles, or you can also call as oily vehicles. The commonly used non-aqueous vehicles are oils and alcohols. So oils are used as a non-aqueous vehicles. So fixed oils such as arachis oil, cottonseed oil, almond oil, sesame oil are used as a vehicle. The oily vehicles are generally used when a depot effect of drug is required. Now what mean by depot effect? The word depot effect indicates that the drug will be released from your dosage form for a longer period of time. Might be for 1 day or 1 month or 1 year. So for preparation of depot preparations, oily vehicles are used. The oily vehicles are generally used when a depot effect of the drug is required or the medicaments are insoluble or slightly soluble in water. Obviously, when the medicament is insoluble in water or slightly soluble in water, at that time you can go for oily vehicles, or the drug is soluble in oil. For example, by dimercaprol injection by using arachis oil as a vehicle. If drug is insoluble in oil, then in aqueous vehicle, then oily vehicle or non-aqueous vehicle can be used. Other than oils, ethyl alcohol is also used as a non-aqueous vehicle, but it may cause pain and tissue damage at the site of injection. Site of injection लगाणार त्यांनी pain किंवा tissue damage होईल. If ethanol is used as a non-aqueous vehicle, therefore it is not used commonly. Propylene glycol is used as a vehicle in the preparation of decoxin injection. So propylene glycol is also used as a vehicle because it is relatively non-toxic but it causes pain on subcutaneous or intramuscular injection. Sometimes polyethylene glycol and glycerin, usually diluted with sterile water, are used for preparation of solution for injection. Polyethylene glycol and glycerin, which are diluted with water, may be used for preparation of injection. They are used as a solvent as well as to increase the stability of certain preparations. The non-aqueous vehicle used should be non-irritating, non-toxic and non-sensitizing and must not exert an adverse effect on the ingredients of the formulation. So aqueous vehicle should not cause irritation, should not be toxic, should not be non-sensitizing and should not interact with active ingredient. Also, it should not have any pharmacological activity. Okay, it should be physical and chemical stable at various pH level. Viscosity of non-aqueous vehicle use should be such that it allows ease of injection. So what happens if oils are used, then they may be problematic for withdrawal into the syringe and for injection into the patient. So viscosity should be such that there should not be problem for withdrawal of this injection into the syringe. High amount of viscosity may cause syringeability problem as told. So these are the vehicles which are used for preparation of parenteral products. So aqueous vehicles and non-aqueous vehicles. Aqueous vehicles are water for injection, sterile water for injection, then bacteriostatic water for injection, and non-aqueous vehicles are oils as well as your alcohols. Oils as well as your alcohols are used as a non-aqueous vehicles. Then along with vehicles, additives are also used for different additives. As you know that different excipients are used for the formulation of different pharmaceutical dosage form. Likewise, in the preparation of parenteral products, different excipients are also used. So apart from vehicle, other additives are also added in parenteral to improve quality and stability. So why additives are used? So different additives used for the preparation of parenteral products are or should be compatible with other ingredients and should not have pharmacological effect. Also should not produce any toxicity. Also should adjust with various pH levels. Okay. So first additive used in the preparation of parenteral product is antimicrobial agent. So all you know that antimicrobial agents are used to stop the growth of microorganisms or to kill the microorganisms. So to inhibit the growth of microorganisms accidentally introduced during withdrawal of individual doses, a suitable preservative system is required in all multiple dose parenteral products. So remember this, that antimicrobial agents are generally used for multi-dose containers. Okay, in single dose containers, antimicrobial agents are not generally used. So why in multi-dose containers antimicrobial agents are used? So while formulation there is no problem, but while withdrawal of the particular amount of dose. Suppose 10 ml vial is there, 10 ml ampoule is there, and if 1 ml dose is required, then physician may take 10 times that dose, may withdraw 10 times that particular dose, and during withdrawal of the dose there are chances of introduction of foreign or foreign particle sorry microorganisms inside the preparation. So to protect that preparation from microorganisms, antimicrobial agents are used. So preservatives may be added to a single dose parenteral products that are not terminally sterilized as a sterility assurance measure. So in single dose containers, preservatives can also be added if that single dose containers are not terminally sterilized. Now what is the meaning of terminal sterilization? So terminal sterilization indicates sterilization of your final product. Sterilization of your final product. So prepare the product, and after preparation of product carry out the sterilization. Generally, for the preparation of parental dosage form, we have to see that in detail also. But when parental dosage forms are prepared, these are prepared in aseptic conditions. And to again ensure that there is no chance of microbial contamination, after preparation or after formulation of dosage that are sterilized, that is that for sterilization, that kind of sterilization is called as a terminal sterilization. And in case of terminally sterilized product, antimicrobial agent may be added. Single dose container antimicrobial agents may be added to prevent growth of any microorganism that could be introduced, or there were any intentional violation of asepsis during filling operation. So asepsis means absent of microorganisms. Example of different antimicrobial agents used. So the word anti is not there. So example of different antimicrobial agents used are benzalkonium chloride, benzthonium chloride, benzyl alcohol, butyl paraben, chlorobutanol, metresol, methyl paraben, phenol, phenyl mercuric nitrate, propyl paraben, and thiomersol. So these are the different antimicrobial agents which are used for the preparation of parental products. Then antioxidants. So antioxidants, as name indicates, these are the used for prevention of oxidation of your product. So oxidative degradation of many drugs in a solution may occur during storage. Such reactions are accelerated either by the free radical, by molecular oxygen, or often involve the addition of oxygen or the removal of hydrogen. So all you know that because of oxidation, there are chances of degradation of product. So metal, hydrogen, and hydroxyl ions may also cause oxidative decomposition. Drug possessing a favorable oxidation potential will be especially vulnerable to oxidation. For example, a great number of drugs are formulated in the reduced form and are easily oxidized. So majority of drugs are there which are vulnerable for oxidation. By increasing the oxidation potential of the drug, oxidation can be minimized. Most common antioxidants used in aqueous preparations are salts of sulfur dioxide, including bisulfite, metabisulfite, sulfite. These antioxidants are being preferentially oxidized and gradually get consumed over the shelf life of the product to maintain product stability. So what the antioxidant products do, or antioxidant agents do, they undergo oxidation and prevent oxidation of your main product. These antioxidant agents prefer themselves to be oxidized, and hence the product is not oxidized. These antioxidants are being preferentially oxidized and gradually get consumed over the shelf life of the product to maintain product stability. So ascorbic acid, tocopherol, sodium metabisulfite, citric acid, ethylene diamine tetracitic acid, that is EDTA, are some common examples of antioxidants. The next, buffers. As you know that buffers are used to maintain the pH. So many drugs require a certain pH range to maintain product stability. In order to maintain the stability of product, or in order to maintain or increase the stability of product or drug, pH of that particular dosage form should be maintained. Drug solubility strongly depends on the pH of the solution. Solubility also depends upon the pH. Hence, if there is a change in pH during storage, then there might be chances that drug may get deteriorized, product may not remain stable, or drug solubility may decrease, and hence all these processes may lead to less and less stability of your product. Okay, so to avoid this, buffers are generally used. So change in pH may occur during storage, may occur by the dissolving glass constituents in the product, by releasing of the constituents from rubber closure or plastic components in contact with the product, or by of, dissolving of gases and vapors from the airspace in the containers, or by reaction with the products. So these different processes make a change in pH. And buffers used for parenteral consist of either a weak acid and the salt of the weak base, or weak base and the weak acid and the salt of the weak acid. So the buffers are basically used to prevent change in pH of the parenteral product. Then chelating agents. So chelating agents are added to complex and thereby inactivate metals. So chelating agents basically react with the metals which are present in the parenteral product and will form a complex. So inactive metals like copper, iron and zinc, which generally catalyze oxidative degradation of the drug molecules. And if these metal ions are chelated with your chelating agents, then these metal ions will not cause oxidative degradation of the drug molecules. That's why chelating agents are used. Metal contamination can occur from various sources like raw material, impurities, solvents such as water, rubber stopper and containers and equipment employed in the manufacturing process. So these are all the sources of the introduction of metal contamination inside the parental product. And if metals are introduced inside the parental product, then this metal can cause degradation, oxidative degradation of your product. And to prevent this oxidative degradation, we have to chelate these metals with chelating agents. The chelating agents will form a complex with the metals, and then these metals will not be available for oxidative degradation of the product. Then inert gases. Inert gases are generally used. Look, when you fill any type of container, the head space, that is the empty space inside the bottle, may contain oxygen, and that oxygen may cause oxidative degradation of the product. Hence, to remove that oxygen from the head space or the empty space present inside the vial or ampoule, you have to use the inert gases. So by displacing the headspace air above the solution with nitrogen or argon, integrity of oxygen sensitive medicaments can be enhanced. So if you use nitrogen or argon, these inert gases, then oxygen gets displaced and stability of product increases. Effectiveness of this technique may be improved by first purging with nitrogen or reducing dissolved oxygen by boiling the water. You may use nitrogen or you may boil the water. Boiling of the water may also cause a decrease in oxygen content. Nitrogen or argon is also purged before filling of the container. Empty containers can also be purged with nitrogen or argon. The next is surfactants. So surfactants are basically used for formulation of emulsion, basically fat soluble vitamins, for formulation of fat soluble vitamins, to dispose a water insoluble drug as a colloidal dispersion. So sorry, the word is disperse. To disperse a water insoluble drug as a colloidal dispersion, for wetting powder, to prevent crystal growth in a suspension, to prevent acceptable syringeability, for solubilizing steroidal and fat soluble vitamins. So surfactants, basically these are the agents which reduce the surface tension. Then next is the suspending, emulsifying and wetting agent. As the name indicates, these agents are used to for suspending your non-soluble drug inside the vehicle. Emulsifying agents are used for formulation of emulsion, and wetting agents likewise as a surfactants. Wetting agents are also used for wetting of non-wettable powder inside the vehicle. The suspending agents are used to improve the viscosity and to suspend the particles for a longer period of time. Methyl cellulose, carboxymethyl cellulose, gelatin and acacia are commonly used as suspending agent. Emulsifying agents are used in sterile in sterile emulsions. For this purpose, lecithin is generally used. So lecithin is an agent which is used as emulsifying agent for the formulation of parenteral products. The wetting agents are used to reduce the interfacial tension between the solid particles and the liquid so as to prevent the formulation lumps. They are also act as anti-foaming agent to subside the foam products during shaking of the preparation. So wetting agents will be used basically for wetting of the powder so that that powder completely mixes with your vehicle. Also it prevents the foam formation. The next point is importance of isotonicity. I think we have already seen this point. What we mean by isotonicity? What is the importance of isotonicity? What happens if the product is not isotonic? So isotonicity plays a very important role in parenteral preparation because product may penetrate inside red blood cells and cause hemolysis. So if product is not isotonic, then there might be chances of damage of the cells. So this can be greatly reduced if the solution is isotonic with blood. That is the cell maintains their tone. Hypertonic solutions have less osmotic pressure than the blood plasma, and hypertonic solutions have more osmotic pressure than the blood plasma. In hypertonic solutions, cell may swell and burst because of difference in water into the diffusion of water into the cell, that is hemolysis. If you introduce hypertonic solution, the cell may lose and water and shrink. In isotonic solution, that is 0.9% sodium chloride, the cell maintains their tone and the solution is said to be isotonic. So in case of isotonic solution, cell it does not affect the cell, but in case of hypotonic solution and hypertonic solution, there might be chances of bursting of the cells. So this is the isotonicity, and isotonicity is the one of the important criteria for all kinds of parenteral product. Then next is the production of production procedure for parenterals. Then what are the different steps which are carried out for the production of parenteral preparations? So there are different number of steps. Then after that we have to see evaluation of parenteral preparations. Then labeling and packaging. Then different production facilities and control for parentals. We will see that in next lecture.